Hi, everyone. Thank you so much for joining us again today for Eye Health Conversations with Dr. Okogbaa. I am so excited about our conversation today. I have such a wonderful guest who is going to share some great pearls and wisdom with us, and I'm really looking forward to this time. So, as everybody knows, or for those who don't know, November is Diabetic Eye Disease Awareness Month. And the reason why there's even a whole month dedicated to diabetic eye disease is because it's so prevalent. Okay, so we have 9.8 million Americans who actually live with diabetic retinopathy. And for those who don't know, diabetic retinopathy is when you start having damage from your diabetes happening in your eyes that can lead to eye disease, loss of vision, loss of productivity. It just starts affecting all areas of life. So it is appropriate that they've made this a whole month so that people can be aware of this happening. And knowing that diabetes is one of the most preventable, well, diabetic eye disease is actually very preventable if we catch it on time, if we do the things we should do. And that's really one of the things that has prompted us to have this conversation today. So I just want to welcome Dr. Olabintan for taking her time. She is a friend, a colleague, and she has come to really, be here with us and talk all about lifestyle and some of the things we want to change. I'm going to let her introduce herself, but she is a board certified family physician. She's also board certified in lifestyle medicine, obesity medicine. So she has a long resume, but I'm just going to let her go ahead and introduce yourself, Dr. Ola Benton.
Thank you, Dr. Okogbaa, for the privilege to be here. I am honored and delighted at the same time. So thank you. I'm Dr. Olabintan, as Dr. Okogbaa said, I'm a physician and all the things, but I'm also a foodie. So 'cause sometimes I like to say that because we tend to think because I'm lifestyle and obesity, I don't eat. I enjoy a good meal, but I find creative ways to help people use lifestyle hacks. So how you sleep, foods, what you drink, how active you stay, and mindset, as well as sleep to help improve quality and quantity of life, including as related to diabetes. Also a mom, Christian, and a dog mom too. Got two dogs, so yay. And I'm also CEO and co-founder of Livingspring Family Medical Center in Mountain View, Texas, where we help people live long and well. Yes.
Wow. We are so excited to have you here and we can't wait. So let's just jump right into it. You kind of heard, my intro. Diabetic eye disease is very prevalent, and we really just want to reduce that. We want to stop that. And I really believe that knowledge is power. When people know what they should do and they do it, then the result is they have better vision, they have a better life, they have better health. And so, my very first question for you is somebody who's newly diagnosed with diabetes. What are some of the things, some of the tips you can give them as to what to do? What should they do?
So,
Lifestyle.
yeah, first of all, I let them know that it's possible to reverse diabetes, actually. I've had clients who've gone from A1Cs of 11 to 6 without medicine. So, with and without medicines, they're letting them know that there's hope. It's not a death sentence. So, there are things that they're going to need to do. And we can talk about the how. So, that's one. And then two, the first thing I tend to go towards is kind of a quick 24-hour, like, okay, what do you enjoy? Like, no shame in your game. Just let's keep it real and kind of educate. Like, for instance, one of the ones that came to mind is a client of mine who likes cranberry juice. She said, "You said eat fruits and vegetables, and cranberries, you said, are high in antioxidants, so I've been drinking them." And then I had to say, "Ooh, have you tried cranberry before?" And she's like, "No, cranberries are very bitter, like sour bitter. So the cranberry juice had to have a lot of sugar for you to enjoy it." Same thing with lemonade. Lemons are naturally bitter. And so sugary drinks are usually the first things I try to educate or say, hey, you're drinking more sugar than you may know. So, or soda. I have pushback on this one. So, a typical soda drink has 42 grams of sugar, which is equivalent to 8 teaspoons of sugar just in that bottle. And so, or the can, the little can. And so it's like, Can we negotiate that? That's usually one of the things I'm doing. Aside now, depending on how bad diabetes is, like if it's
Mhm.
A1C is very high, then I can sometimes negotiate. Let's start medicines. Let me stick a glucose meter on you so you can see in real time what your sugar is doing, depending on what you're doing.
Mm.
So you get real
Yes.
time data. They're like, oh, I noticed that when I ate bread, it went up. But bread is not sweet. Doesn't have to be sweet to have high sugar when we talk about different carbs. So I'll say the big thing is depending on the level of the how bad the diabetes is, it's more educating on what you typically go to for drink. Coffee is one. The
Mm.
supplement, chucka, whatever, all the things loaded, concentrated sugars, and we start to say, let's tweak that a little bit, maybe give you medicines, and then find creative ways. How can we get you to move more? Because it burns sugar. And so sugary drinks, processed sugars, monitoring your sugar to help keep you accountable. And then let's start, you know, movement, like finding other ways to get you to move that doesn't feel like
Yes.
it.
Yeah. So, for me, when someone come in for their diabetic eye exam, the first thing I want to know is what's your A1C? Because that then, kind of dictates and guide how we're going to have a conversation about their eyes. And I didn't realize until, I was preparing to meet with you how much I actually rely on that number. Like, so anyone, what's your A1C? What's your A1C? Can you describe what is the A1C to our audience, and how do we gauge it typically
So
for
it's
that?
it's called glycosylated A1C. And what it does now, this test is good for people who don't have underlying red blood cell issues. So sickle cell disease, this is not a good one to measure. But it tells you what your average sugars are over the past 3 months. So
Hmm.
it's almost like a lie detector test. So no, my sugars are good. It's been good. 120. I'm like, well, over the last 3 months, the average. So A1C is between um, 6.5 and up is in the diabetic range. A1C is between 5.7 and 6.4 is pre-diabetes, and then less than 5.7 is non-diabetic. All right. So the A1C tells your average is, blood sugars over 3 months prior to when you do the test. Also, it's important to note that you don't have to be fasting to do this test. Because people are like, oh, I fasted, or I
No.
didn't fast, that's why my sugars. You don't have to be fasting because essentially it takes what your average sugars are. From that time point, you do the blood work 3 months before. So fasting or fasting don't make a difference. It tells what your sugars have been on average. So it doesn't make a major difference over a 3 month mark. Yeah.
Yeah, that's incredible. Thank you for explaining that, because when they're a lot of time folks are coming to me as their eye doctor because their A1C is now 10 and 11, and their vision is starting to be impacted. They get that acute vision change because there's so much glucose in their system that it's now impacting their immediate vision, which in many cases it's kind of different than developing diabetic retinopathy. A lot of times that's just kind of uncontrolled from over years of not controlling your sugars. And so yeah, so sometimes, so I always want to know, okay, what's your A1C, what has it been doing, and what are you doing? And a lot of things I hear is, oh doc, I'm taking all the medications, I'm doing my best. But I always sense a lot of time it's more the lifestyle, and I find myself sometimes having to do some counseling on what are you actually putting in your mouth, and what is your life like. And so yeah, I truly appreciate that you mentioned these things. Now, what else as far as like everyday habits? Things that can. We talked some about the different foods, but anything else as far as patterns, movements, when they should eat, when they should not eat. It kind of gives people some more tips on what they can do to lifestyle change wise to help them in controlling their diabetes so that they won't get these eye diseases and so on.
So the eating patterns are very important too. So, some people will go all day not eating, or drink their calories. So coffee with the sugar, the creamers, and creamers do have sugar in them too. Or the yogurt, high protein but high sugar too. And then, or they won't eat anything and then eat heavy. dinners, all right, and then go to bed. So and the dinners are usually high in carbs. And
Mm,
so it shoots shoots your sugars up. You wake up with high sugars. Now, one of the things I'm cautious about with food is, from trying to be culturally sensitive. I'm Nigerian. Tell me take away rice, cut you. But
yes.
for my Hispanic patients, the rice and beans, that's life, that's culture. So it's kind of shifting the ratio. So going for protein first and good
Mm,
quality protein. So your chicken, your fish, your beans, there are over 200 varieties. That's why I share crock pot recipes that you can implement to create, bean soup to accompany your meal. Your chicken, your fish, your turkey over cow, and pork, right? So going for protein first, then knowing what non-starchy vegetables are healthy. Would you know that sweet potato actually is a better choice than Irish potatoes, but sweet potatoes taste sweeter? Huh? Do you know that berries are very good for you as a diabetic when it comes to fruit? But I wouldn't do overripe bananas or watermelon. Like, we've got to really learn the sugars. You got like white rice, even though it looks unprocessed, it's actually processed. If you could do brown rice, a bit better, quinoa, or do more of the beans than the rice. So the food is big. Then movement. Oh my goodness. What
yes.
I tell people is this: find ways to work on their time. So I was talking to a teacher today. I said, they have recess. No, she's like, no, sixth grade. I'm like, but they have to have them have an activity. She's like, yeah, volleyball. I said, how about you also
Mm,
participate in volleyball? Be the teacher that walks around. So find ways to move while at work. You spend a lot of time at work. And if you do that an hour after your meal, it would help because you bring the sugar down. Number
yes.
three, yes. I typically also say, try not to multitask where you don't
Uh,
enjoy the food more and you eat more. I've had a bag of boom chicka pop and I'll single eat that. Someone gifted me a boom chicka pop. It's the Big Sam's one. And I was, watching the show with my kids and I ate the whole bag. And yet I was questioning who ate the bag with.
yes.
Yeah. So mindless eating. So if you can, even at work, the 10 minutes where you take the time to really enjoy your food, enjoy the flavors, it hits the spot more. You're not distracted. You enjoy. You may not have to eat a whole lot. So mindful eating is another one.
Mm,
Movement, knowing your carbs, and sleep. I can't, when you don't sleep, your cortisol levels go up. When you're
yeah,
tired, you notice like you really want to carve you tired. You don't make good choices when you're tired. When
that's
it
true. I
comes
can
to so
attest to
yeah,
that.
yes, so sleep well too. That helps.
So you just gave us some great, great tips, right? So the foods we eat. Now, I'm glad you mentioned sweet potatoes because that's one of the superfoods for your eyes, right? So I always say the orange foods, carrots, sweet potatoes, because everybody asks me about carrots. Yes, but that's not the only one. Carrots, sweet potatoes, oranges, all those have those eye nutrients that you can get naturally from foods. Also, your green leafy vegetables, all good for your eyes. So there's even some specific superfoods that are really, really good for your eyes. But generally, I'm like, whatever you put that's good in your body, guess what? Your eyes benefit from that too. So that is so, so good. And the whole idea of being mindful, because a lot of us are not mindful of what we're putting in our mouth or when we eat, right? So we can eat at night and it just sits there. And so, yeah, so those patterns are very important. And of course, making sure we get enough sleep. So all of these are just so super, 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 super good to know. Now, one of the things I wanted to ask you about is how do you partner or have the patient partner with their eye specialist and their primary care doctor for their overall health so that we all work in tandem to help them, you know, to not develop to not get to a stage where developing eye disease and such with their diabetes. What's your perspective as a primary care physician?
So one of the things we advocate for and encourage is you should have at least a yearly exam. And diabetics, I think, maybe twice. well, because you're going to catch things before they become a problem. And so it's who's your eye doctor? So part of the questions we have the team ask before I even get in the room is, when's the last time you saw an eye doctor? And then, we try to add their information to the chart so they automatically get a summary of what we talked about, including their blood test. So they see that data too. And then two, also asking them to advocate for themselves in their eye doctor's office, get their records or have them send it to us or tell them we, so you can send the information to us so we see how you do when it comes to your eyes as well. But it's a team effort, it's like a team sport. Everybody has their part. There's the quarterbacker, there's the guy who, I don't know, runs and takes the guy down. I don't want you. Okay. They're
Right.
different people that play the sport. And so we want to share reports, but it's really important that as a so when you see the eye doctor, that you see a primary care doctor too. So there's a liaison between the two people. And so I definitely recommend, I'm wearing glasses. I see my eye doctor once to twice a year. Your eyes are very valuable. Sometimes you know what you have till you start to lose them. So please, eye changes are subtle.
Mhm.
Most people don't go from, oh, I see to it. It's subtle, like little changes over time, gradual. And you don't want to wait till it's irreversible. And so sharing reports, advocating for each, for yourself, with your primary care doctor and with your eye doctor. And also as primary care doctors, we also need to, connect. Like my eye doctor, I send a lot of my patients to, because I know him and I told him I needed to send reports to me and get them in quickly. So forming relationships with doctors around you is also helpful, so you can do a better coordination of care between both sides of the coin. Yes.
Yeah. Oh my gosh. Yeah. Thank you for saying that. It's definitely a team effort. I can tell you that. Sometimes, I'll have patients, they don't know what their A1C is or something like that. And sometimes we gotta, communicate with their primary care doctor to find out, okay, what's the real status? Because they're thinking their sugar is 100, but their eye is telling me something different and all of that. And so when we communicate better as physicians, then we're able to all do better for our patients. And I tell patients, usually the minute you are diagnosed with diabetes, your next step is to get an eye exam for exactly the same reasons that you just stated, because sometimes these things are so subtle that you're not having symptoms, and yet the diabetes is already starting to cause problems for your eyes. And the only way we can actually detect that is to make sure you get your eyes examined by an ophthalmologist. So yeah, so that's extremely, extremely, extremely important. And then one of the efforts I try to do is try to definitely work with primary care physicians, colleagues, with sending them the eye reports of the patients so that the patients know, hey, I'm sending this to your primary care doctor so that, they know what's happening with your eyes and I know what's happening with your blood sugars. And so we're all working together to help you stay healthy. And so that's extremely, extremely important. So thank you so much for bringing that up. So I really enjoyed our conversation. You gave us some great tips on foods, patterns, being mindful of what we eat, when we eat, movement, sleep. All of these things impact our health as well as our eye health. And so you heard it directly from the lifestyle doctor. So make sure you take these tips and implement them today. Thank you so much. Please, if you have any last minute tips you want to leave our audience with, I would appreciate it.
Don't give up. I tell this to my clients a lot. Don't give up. Yes, when you come, we tell you the same thing: eat better, move more. See us every year. As long as you don't give up your health, there's always hope, right? There's always hope. So please, 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 your life is too precious to give up on. So yes, it'll cost you some food. It will cost you some lifestyles, twitches. It'll cost you some conversation and nudges and text messages and emails and all the things. And this live, right? We're having the same conversation. Please don't give up on your health. There's hope, and diabetes can be managed. Yes.
Yes, yes, yes. You heard it here. So it's manageable and we can prevent vision loss, we can prevent blindness by taking care of your diabetes. And so thank you so much. Dr. Olabintan, for coming on today and to speak with everyone. Please let us know where we can find you.
Oh, awesome. You can follow me on YouTube, Dr. _Olabintan MD. Instagram also Dr. _Olabintan MD. I also have a podcast, Living Long and Well with Dr. O. You can find it on all podcast platforms, and also you can follow me on Facebook. If you just Google Dr. Tolulope Olabintan, you will find me. Yes.
Awesome, awesome. And we'll have all that information for anyone who's around the Mansfield area, anywhere in Texas, really, or anywhere drivable. You should be able to find the doctor. Get that diabetes taken care of. And so we appreciate you coming. And for everyone, if you have not had your eye examined for this year, the year is about to be over. Please make sure you contact us, get on the schedule, get your diabetic eye exam done. This is Dr. Okogbaa with Louisiana Center for Eyes. So if you live anywhere in Baton Rouge, around the Baton Rouge and surrounding areas, we are more than happy to see you. Give us a call. Check us out on the website, Facebook, wherever. So thank you so much. And we will come back again for another eye health conversation. Thank you. Bye.